You ready for some handy tips for OA of the hands? I mean, it really is a problem.
Oh my goodness,
Yeah.
I feel it.
Well, you use your hands
I
a
use
lot.
my hands, but still,
People who use their hands a lot.
Yeah, I think everybody kind of feels that weakness sometimes. Opening jars.
Yep.
You know,
Well,
whatever it may be.
8% of people over the age of 65 have it, and it's going to contribute to your grip strength. And grip strength is really important because it predicts mortality. You know, it's a biggie. So
It's kind of crazy how much grip strength can show about your overall health.
Yep.
Yeah.
So you want to make sure that your hands are in good shape. And the best way to test is to go to a therapist and they'll do a dynamometer test where they have you squeeze a dynamometer. So that's probably the real key, the real gold standard. For you, it'll be just, you know, if you find that you're having trouble opening jars or, you know, using your hands for precision type things. Any other cues on that?
I mean, I think if your hands are achy, if you just have discomfort in your hands, or especially in the cold, if you notice that your hands get stiff and they are a little more painful, I think that's a pretty good indication you might need to spend a little bit of time giving some love to your hands.
Yep. And there's a thing called a shoulder sign. So your hand right here actually comes out and it looks like a shoulder. All right, that means that this joint right here, and that's the first joint usually to get the arthritis,
In your
all right,
thumb.
will start to come out in your thumb area. And anytime your joints get real big on the edges, okay, not these joints, that's another kind of arthritis, but the ones on the ends, that's your osteoarthritis. So it will affect function. You might have trouble, you know, holding pans and pots and things like that. All right, so
what are some things we can do?
okay.
Yeah.
Well, so you have to be careful. You don't want to overdo. All right, because that could make it worse. You want to find things that make it feel better. Oftentimes putting on topical things like Voltaren, now that it's available, I'm so happy.
Yes,
I used to like
over-the-counter.
do drug running up to Canada to get it. I did. I
Yeah,
go
for
up
a
to the
long time.
drugstores because you couldn't get it
Yeah,
here.
right.
And my patients got such relief with it. You know, just put it on. Here's the thing, if you do use topical type of non-steroidals, they're actually a little better for you because they don't go through your stomach. But people expect the results in a day.
Yes.
And you got to give yourself a week, and you have to use it 4 times a day.
Right.
All right. If you use it once or twice,
not
you go, it
enough.
doesn't work.
Right.
It doesn't work.
Yeah.
All right. So that's number one, to get some of that inflammation out of, you know, especially if it's just one joint, real easy to do. And then balance your strength with your function, and you don't want to cause flare-ups, right?
Right. I think this is the one area talking to people about not overdoing, and it isn't all about strengthening and more is better in this condition, because you can cause flare-ups, and that's going to contribute to a longer recovery from that flare-up, which is just going to inhibit your function a little bit more. So really finding that balance point.
Right.
And then using like modalities like paraffin baths, which is like a wax you can put on your hands, or just
And you just dip into it.
You dip into it, and then you make
it feels great.
It feels really good, and normally
And it helps. It doesn't just feel good. It gets rid of some of the pain.
Exactly, and inflammation.
Yep.
And like normally as therapists, we don't like passive modalities as much. This is the exception.
Yep,
So
yep.
I think heat, the paraffin baths, the topical anti-inflammatories are great strategies to help reduce pain.
Yeah, and you heard us pulling somebody's leg. Well, pull their finger. All right, this is called long axis traction, and just giving a gentle pull. You can do it on yourself, or you can do it on somebody else. That can help give you some relief. All right, and then there's a big muscle right here called your first dorsal interosseous. I have way more information you ever wanted to know. It's gonna be a quiz. It's gonna be a quiz. Anyway, but you press on that, and again, there's been studies that show just giving some pressure on that can give you some relief. It gives some rest to that really painful joint. All right, so that helps. Then, do you want to go over some motion?
I think just general range of motion rather than really aggressive stretches. But our joints, our fingers have multiple joints in them. So working each one individually, just through your range of motion.
And she's
like
a perfect example of,
Yeah.
they're better to do on a table.
Yeah.
Because if you try to do individual joints not on a table, so watch,
Yeah.
if I pretend my hand's a table,
Yeah.
she can bend those end fingers. If she tries to do it, the other one's
everything
coming.
bends.
Right,
Which
right.
you want to kind of isolate and try to do one
And
joint
if you
at
just
a
put
time.
it over the edge,
Yes.
you can get each of the joints.
So I think that's a nice thing just to keep, because when you do a little active range of motion, you get a little lubrication to the joint.
Yep.
And so doing that at each kind of knuckle. just a few repetitions, 5 or 6. I think that is good for just maintaining mobility.
Yep.
Anything else you like?
Oh, I love so here's what we forget. We forget
Yes.
all the deep muscles in the hands.
Yeah.
So just having your hands spread them apart. You can do it, again, flat on a table. There's another one that I really like called radial side walking. So if your hand's on a table, you're just going to walk towards your thumb side. That's your radial side. So the thumb will go this way, this way, this way, this way, this way, and then relax, shake it out, do it again. Everything towards the thumb. Do. Okay, relax, do it again. And that helps because oftentimes your hands get, a lot of what we do is more towards the other side of the hand. That's how we open our jars. So if you take the time to go the other direction, you can get good results. Putty is okay.
Putty's
Squeezing
okay.
putty.
Yeah, gentle
There's
squeezing,
studies that
yeah.
show that that'll make you stronger. And then the other thing is it's not just, grip strength isn't just the hand. It's strength in the whole upper extremity. So do a full upper extremity strengthening with your putty and your motion and your pressure.
Yeah, the stronger you are in the more proximal joints, the less pressure down the chain.
Yep,
So that's a great point. I think that's, often overlooked.
Okay,
Great.
so I think those are some good ideas.
Yeah, all right. Those are your exercises for aging well.